Fentanyl is a synthetic opioid. This means it is a man-made drug that acts like opioids found in nature, such as morphine. It was initially developed to manage severe pain, particularly in hospital settings.
Fentanyl is much stronger than heroin or prescription painkillers. It is 50 to 100 times more potent than morphine. Because it is so strong, fentanyl is very dangerous. Even tiny amounts can be deadly. This is especially true if someone doesn't know they are taking fentanyl.
Fentanyl is often mixed with other drugs or made to look like prescription pills. People may think they are taking a different drug, like heroin or oxycodone. They may not realize they are taking fentanyl at all. This makes the risk of overdose much higher.
Fentanyl's potency and its presence in counterfeit pills are major contributors to the current overdose crisis. Drug dealers often mix fentanyl with other drugs without the buyer's knowledge. Even a tiny amount of fentanyl.
Counterfeit pills often contain fentanyl instead of the drug they are supposed to contain. People who unknowingly take these pills are at a high risk of overdose.
The consequences of fentanyl use are devastating.
Narcan, also known by its generic name naloxone, is a medication that can rapidly reverse an opioid overdose. It works by blocking the effects of opioids on the brain. When someone overdoses on opioids, their breathing slows down or stops altogether. This is because opioids depress the part of the brain that controls breathing.
Narcan attaches to the same receptors in the brain that opioids do. By doing so, it knocks the opioids off the receptors and reverses the overdose. Narcan is highly effective in reversing opioid overdoses. It is administered as a nasal spray or injection. When given promptly, Narcan can restore normal breathing within minutes. This quick action is crucial in saving lives because every second counts during an overdose.
Narcan is a safe and non-addictive medication. It has no effect on someone who is not experiencing an opioid overdose. This makes it a vital tool for first responders, healthcare providers, and anyone who may encounter someone at risk of an overdose. Narcan is a powerful tool against opioid overdoses, but there are challenges, especially with fentanyl. Fentanyl is much more potent than other opioids. Larger doses of Narcan are often required to reverse a fentanyl overdose. Multiple doses may be necessary. Fentanyl stays in the body longer, risking relapse after Narcan wear.
The need for multiple doses highlights the importance of having them readily available. First responders and healthcare providers should carry multiple doses.
Addressing the fentanyl crisis requires a multi-pronged approach that includes education, awareness, and increased access to Narcan. Public education campaigns are essential to inform people about the dangers of fentanyl. These campaigns can educate individuals about the signs of an overdose, how to administer Narcan, and the importance of calling for help immediately.
Raising awareness about the prevalence of fentanyl in counterfeit pills is crucial. Many people are unaware that pills purchased online or from illicit sources may contain fentanyl. Spreading this information can help prevent accidental overdoses.
Increasing access to Narcan is paramount in saving lives. Making Narcan readily available without a prescription at pharmacies, community centers, and through harm reduction programs can empower individuals to respond to overdoses. Training programs on how to administer Narcan should be widely accessible. These programs can equip individuals with the knowledge and skills to confidently respond to an overdose situation. The more people who are trained to administer Narcan, the greater the chance of saving lives.
You need to hear this if you're a community leader, healthcare provider, or someone affected by addiction. Combating the fentanyl crisis demands a comprehensive approach that goes beyond simply responding to overdoses.
Prevention is key, and this includes addressing the root causes of addiction. Expanding access to treatment programs for substance use disorder is essential. Treatment programs should provide a range of evidence-based interventions, including medication-assisted treatment, counseling, and support services.
Addressing co-occurring mental health conditions is also crucial, as mental health disorders and substance use disorders often go hand in hand. Reducing the stigma associated with addiction is important. People struggling with addiction should feel comfortable seeking help without fear of judgment or discrimination. Creating a more compassionate and understanding environment can encourage individuals to seek the treatment they need.
Ultimately, saving lives and preventing overdoses requires a collaborative effort. This includes government agencies, healthcare providers, community organizations, law enforcement, and individuals working together to address this complex issue. By combining education, awareness, access to Narcan, and comprehensive treatment options, we can make significant strides in combating the fentanyl crisis and saving lives.